Good morning, everyone. My name is Abdullahi Ibrahim Umar from Kalinga University, Narepul, Chhattisgarh, India. Faculty of Pharmacy, 8th semester student. So today I'm here to discuss regarding hypertension. That is management, control, and prevention of hypertension. First of all, hypertension is a very, very dangerous condition that cause a lot of people died in the worldwide. First of all, according to the World Health Organization, saying that hypertension, it is higher blood pressure, is the pressure when your blood vessel to higher than 140 or 90. That is 140 over 90. That is systolic and diastolic, or more than this. Also, hypertension is divided into two. We have primary and secondary hypertensions. First of all, primary hypertension, it is unknown causes hypertension. It is essential hypertension, about 95% of hypertensions. When secondary hypertension, it is hypertension that caused due to the another condition, especially like kidney disease, endocrine system disorder, and other pulmonary disease, liver disease, or some hypertension during pregnancy. But especially kidney disease, it is condition that causing hypertension. So we have symptom of hypertension. When we're talking about symptom of hypertension, we have what? Severe headache. We have blurring vision. We have chest pain. We have vomiting, confusion, anxiety, and abnormal arrhythmia. Also, hypertension have complications like this. First of all, angina pectoris, heart attack, heart failure, irregular heartbeat, that is constant. So we have to go for what? Management of hypertension. When you're talking about management of hypertension, we have to start for what? Diagnosis. When we start the diagnosis of hypertension, we have to using BP apparatus. We have to check the blood pressure of the patient. Is it high or low? So we have what? Again, ECG. And we have what? Echocardiography. And we have X-ray. All these what? They are method for hypertension diagnosis. So we have what? Treatment. When we start the treatment of hypertension, we have what? Different class of antihypertensive drug. First of all, we have diuretic, we have renin system inhibitors, we have sympathetic inhibitors, we have calcium channel blockers. First of all, example of diuretics, we have thiazide, we have glutamate, etc. When we're talking about renin system inhibitors, we have ACE, we have receptors inhibitors, we have direct inhibitors. When we're talking about ACE inhibitors, we have captopril, lisinopril. When we're talking about receptors inhibitor, we have losartan. When we're talking about direct inhibitors, we have aliskiren. When we're talking about sympathetic inhibitors, first of all, we have beta blockers, example propranolol, atenolol, metalol. We're talking about alpha blockers and alpha and beta inhibitors. And we have what? Direct active, that is methyl dopa. That is example of drug that given to pregnant women that have hypertension. So we have to go forward. We have to go for control of hypertension. When we're talking about control of hypertension, especially regular exercise, it is very, very important. Eat healthy diet and reduce salt in your diet. Quick smoking and good sleeping. It is very, very important how to get good sleeping. Because of what? If you get good night sleeping, there is tendency of what? Peace of mind. So I have to go for prevention of hypertension. When we start the prevention of hypertension, first of all, we have to what? We have to eat more vegetable. Vegetable is very, very important, especially like a banana, apple. They are very, very important because banana, there is a lot of potassium. So if there is a lot of potassium, there is tendency of low of what? Sodium in your body. So you have to what? Sit less and what? Lose of weight, that is obesity, and take medicine prescribing by your medical professional, and keep appointment with your healthcare. It is very, very important, because we have to keep appointment with your healthcare, because antihypertensive drug have different implications. Because when you're taking antihypertensive drug, so maybe your blood pressure it is low. So if you didn't meet your medical health care, so there is tendency of hypertension, that is lower blood pressure. So when we meet him, he will check in your blood pressure again. If it is low, maybe if it is less, he will change another class of medicine for you, and maybe he reduce the milligram of the medicine. Also on this thing, also he give you another good advice.